Life is about taking chances, trying new things, having fun, making mistakes, and learning from it. A very good afternoon to all the guests and dignitaries. With a great joy and immense excitation, I feel privileged to extend my warm welcome to all of you in today's webinar, Post-COVID Impact on Healthcare and FMCG Industry, organized by SEMS. I, Ritika Kumari, welcome you all on the behalf of SEMS Group. Before I proceed, let me take a brief moment for the introduction of my organization. SEMS Welfare Foundation is a non for profit entity established to work in the areas of education, social welfare, women empowerment, skill development, entrepreneurship, livelihood generation, and etc. SEMS Group has conducted various webinar conferences, seminar, workshops, and webinar in emerging technologies in various parts of India and has an active network of 3,000 plus engineers, managers, researchers, etc. DD Saksham is an initiative of SEMS Group, which has developed content over 100 webinars. The topic of today's webinar is Post-COVID Impact on Healthcare and FMCG Industries, which is presented by Mohammad Rifat Sir. The COVID-19 pandemic acted as a transformation catalyst, accelerating and implementing adoption of changes in public healthcare interventions and FMCG industry. Thus, a new model of healthcare delivery and FMCG industry emerges with more emphasis on prevention measures, remote cares, substantial technology dependence. To provide the guidance on how to embrace new practices and overcome obstacles, a webinar on post-COVID impact on healthcare and FMCG industry is held by SEMS. I profusely elated to take the opportunity to introduce our chief guest of the day, Mohammad Rifat Sir. Sir is an HR head at International Business and Projects at MNR Solution Private Limited. Result oriented and dynamic HR professional, Sir has done experiment in varied aspects of human resource in FMCG for more than 9 years. He has worked extensively on following fields and now working towards on generating more business and more employment. Sir has a deep understanding of HR process and system. He has an extensive experience establishing organization structures and attaching them with cost centers. Sir has deep understanding on handling and establishing complete TA cycles as well as a deep understanding of recruitment tools, counseling expertise with more employees grievance handling abilities. The world is full of diamonds and gems and we are having one of them here today to build this event. With this note, I would like to give my heartiest welcome to our chief guest speaker, Mohammad Rifat sir, with a big round of applause.
Good afternoon, everybody, and welcome to this webinar. So, as my colleague has introduced you to the topic, which is post-COVID impact on the FMCG and healthcare industry. So, basically, this COVID has been a turn point for the whole industry and the whole corporate world, basically. So, before we start into this, let me introduce myself. And as my colleague has given a detailed introduction on my professional front, let me give you my short introduction on my personal front as well. So basically, she has already introduced me into the HR, how I've been into HR and into businesses. Plus, my personal side, I have two daughters. One is 6.5, one is 3.5. And yes, I love playing hockey and indoor games like table tennis. And I am from North India, but I love sambar rice and dip vada. So good to that. Moving to the topic of the day, which is the pandemic effect. So let us go slowly onto this topic and let's understand the background in which we are discussing about all these things. So hope you guys remember when the lockdown happened. So in some states, in some districts, it happened on 21st, in some second, 23rd. Finally, the Indian government announced that on 24th March, all country will be in the lockdown and there were certain kinds of restriction, the timing restrictions, and the country was globally locked down basically for 21 days, which was another extended by 15 days. And many factories got shut down, the supply chain was crippled, And if we can go by the data, around 278 million square of the space which is of retail. So when I say retail, it is about supermarkets, hypermarkets, all were shut down. And that was the biggest setback and the first time we were experiencing this. So my personal experience into this, I was working in one of the FMCG groups, and when we were shut down initially as an employee, I'm reiterating that as an employee we thought, okay, it's a great opportunity to be at home and it is shut down and we will not be working. But as gradually the lockdown happened, it increased. We thought about that the whole sector is into loss. The supermarket shut down, the sales dropped, the targets were not nurturing, and then it slowly had this impact on multiple other industries as well. Moving further, basically, let us pick the healthcare fraction first. What exactly happened at that time? When the pandemic hit in 2020, which was March month, and we were clueless as what it is basically, what is COVID-19, we started researching about it. The prices of multiple items increased a lot. One of my colleagues and one of my brothers was into dental industry, and we were discussing about the supply chain, creating supply chain into various products. But suddenly, when this lockdown happened, the prices of PPE kits, the prices of sanitizers, the prices of Detol, the prices of gloves, in fact, the prices of other surgical items soared up. Increased demand and consolidation happened, and we actually rain checked as what we were into. The healthcare industry indeed witnessed a record demand for the ventilators, PPE kits, sanitizers, and in fact, the major hospitals on the regular surgery and regular details reported a loss of $200 billion. It's not a small loss. So majority of the hospitals who have purchased the e-scan kits, X-ray machines, e-scanners, CDG machines, and multiple other things, and who have done the recent investments on the hospital setups, they also suffered a huge loss as there were no patient counts. But as gradually we soared up to the COVID thing, we basically many hospitals admitted multiple patients on multiple regards as like oxygens and other things. So not on the regular surgery side, but yes, on a emergency kind of situations. But there was a loss of major loss, like 80% drop in elective surgeries if we count till November, December of 2020. Then many other players in the sector. So if I say adoption of medical manufacturing, so people slowly realize that the importance of medical manufacturing and the availability of technology into the manufacturing availability. In fact, the multiple automakers like Mahindra Auto, Tesla, they started manufacturing ventilators. You can imagine, although they donated few ventilators, they sold few ventilators, they did it for community cause. But my attention is that they started it. They understood the importance and they started it, and they used their facility to manufacture that. In fact, many small suppliers, many small manufacturers, if you can go to the manufacturing sites either in Firozabad, either in Ghaziabad, either in Delhi, either in South India, you will find that in small cities, people were manufacturing gloves. People were, I'm sorry, people were manufacturing masks, which is three-ply mask. People were manufacturing N95 masks. So these things happened, and many people adopted this medical manufacturing as a profession. In fact, moving further, as if we avoid COVID, also there is a lot of focus on the digital revolution itself. So digital revolution has come after the IT, but in health sector we were not recognizing it. But once the COVID came, multiple AI based app solutions came up. If you have heard the name of Practo, if you have heard the name of multiple other channels which are providing, if you have heard about Aster Group, which is providing the AI based doctor consultations, and you have to find the subscription, you have to pay the subscription price, and then you can do a non-end consultation with the physicians. So as our industry surged into the COVID, there were multiple digital interface and remote patient monitoring and teleconsultations for elective non-emergency situations came. So there were a lot of physicians who opted these practices. There were a lot of AI-based X-ray and CT scan analysis happening. In fact, Google and Apple has partnered with the multiple governments or multiple countries to do AI-based contact tracing as well. And if you have traveled in COVID, you must have downloaded this app called Arogya Setu app. This was also a government of India digital tracing platform where they have installed Arogya Setu app if you're traveling, and it was a fantastic thing and it worked in the COVID times. Coming to the next, supply chain management was disrupted with the basically in COVID-19, there were a lot of multinational. So we all basically know that China was the major supplier across the world, I will say. And I am brutally honest in saying this, that China has been the global supplier of everyone and every country. But to the situation, in fact, it supplied Corona as well. But I'm not going into that. That may be a controversial thing. But so many countries opted their facilities out of China. So Japan, in fact, is recently announced that a $2.2 billion funds to set up their manufacturing setups, and they are moving out of China. Same inclination was shown by US, and in the coming years, if we can say from 2022 to 2025, 26, there are a lot of manufacturing setups which is going to come in this Asian countries, including Vietnam, Thailand, India. So there are a lot of manufacturing setups which moved out of China, and people are considering Southeast Asia and Asia. So Southeast Asia considered Singapore, Indonesia, and Malaysia, and they are considering these countries to be the alternative for China. But let's see how we can make up an alternative to China, because it's not an easy thing to make an alternative to China. But let's try for a big success. But again, we can give it to a blessing in disguise kind of thing to COVID, that this happened actually. So moving next, you can see this diagram. Let's read this diagram and then move one by one as what exactly happened. So the medical equipment industry was which makes a non-critical medical equipment. What happened to them actually? So how they face challenge in terms of, like, if you say the demand for pulse oximeter suddenly surged up in 2021, when there was a lot of oxygen shortages. The manufacturers of oxygen cylinders were not able to provide oxygen cylinders. The demand for the BPA machine soared up. The demand for the stethoscope soared up. The demand for multiple other oxygen and blood pressure mapping machines soared up. But again, there were a lot of things which got itself in decline. So there were a lot of uncertain demand, and there were, in fact, it's still not clear which product will be in demand, and their disruptive market supply is there. There were a lot of decline in order. In fact, when there were a lot of orders from China, and there were a lot of orders from Malaysia to India, which got disrupted and which got declined due to COVID. There were a lot of shipments, which I remember, a lot of dental surgical instruments. There were a lot of beds. There were a lot of forceps kits. There were a lot of periosteal kits, which were cancelled at that time. Inventory cost soared up because there are a lot of supply chain disruptions happened globally. So many manufacturers have to increase the inventory cost, and they have to increase the inventory just to avoid the situation of just-in-time situation at the warehouses and at the factory level. Again, going to the short-term challenges which came again, the slower product launch and hiring of capital project, and of course, cash flow issues which came. So after COVID, one thing we noticed in the industry, and so see guys, how it works basically is when you are into procurement, and when you are procuring and when you are buying some big deal, either in healthcare or any other sector, there is a credit clause which is there in the contracts, either 90-day credit, either 60-day credit, or 30-day credit, based on the
Excuse
supplier.
me,
And
sir.
so basically so cash flow issues has happened. So when we are talking about the how procurement challenges happens, So when you are procuring the corporate deals into something, so the big companies stopped the credits, which again, the market was disrupted. So this is something which has happened, and many suppliers induced their new suppliers, and industry consolidation happened. Many industries and factories shut down and were taken over by multiple other big players in the market. We were discussing about the mental health update and how it impacted everybody. So when 2020 came and the COVID happened at that time, and before we wrap up this health sector and move into FMCG, what happens was that industries were not ready for this COVID, and when it hit it to the bottom. Many players vanished from the market, and if we look at the smaller picture, what happened was many people lose their jobs. Many were unemployed. Many were not able to find the jobs. In fact, many students who took student loans from the banks to study were not able to find jobs in the COVID, which resulted in mental health issues in many of the employees, many of the students, and which resulted in many situations which were very alarming at that time. And government took a CEO motto of that situation, and many NGOs were working on it. So this happened due to this pandemic. And if we take the data, the period when the highest rate of mental distress were reported correlated with periods of intensifying COVID-19 deaths. So when this was happening, unemployment, no jobs were there, and suddenly multiple deaths were started getting reported. Many people were confined to their homes. In fact, they started talking to themselves. They started talking to the walls, and this was the psychological pressure, and this was the mental health issues which happened. In fact, mental health services were overstretched till 2020, and when this started after the COVID, this went beyond their challenges. So they were not able to take into the consideration that this mental stress, and they were able to service this mental stress of the multiple people in record time. In fact, most countries started developing new mental health information, or in fact, phone support lines, and giving tips on how to cope measures with COVID-19 crisis. If you remember correctly, the Indian government also issued multiple mental health guidelines, and they started a remote telephone line just in certain that if anybody want to give tips, anybody want to have a talk, and many FM channels started their mental health tips as well. In fact, many OECD countries started putting into place measures on to protect the jobs, incomes, and aid the transition of working from the home. So many countries stopped the reporting of the job loss. They started that convert this office job into work from job, and a transition happened over the time. So countries started giving incentives to the companies who stopped the job loss, and this resulted in reporting of the less mental issues, and people started getting recovered. So basically, labor and youth policies were deployed to tackle this situation. And in fact, many things in related to mental health services were assured by the countries, and in many industries that you can either meet in person or via telemedicine or both. Or there was increase in access, post evidence-based service on priority, and mental health promotion programs in school, workplaces, and in fact, many corporates held the mental health program to access the need for the challenge of the mental health distress among the employees, freshers, interns, and everybody else. In fact, if I correctly remember, I actually was trying to remember back in IFCO, when I was speaking to the talent management director there in 2020 as what the new compensation scheme has to be. They spoke very vehemently on that employee must contribute in supporting the mental health of other employees as well. So basically, they were so instead of announcing multiple compensation, they announced the job retention schemes and multiple implications. So they announced team working, they announced the mental term workings, and mental support for the multiple other job seekers. So of course, hiring was closed, but firing also they stopped. So this type of things they took up to increase the mental health of the employees, you can say students, you can say multiple. In fact, many doctors as well suffered from the mental distress. We wrap up the health sector and move into FMCG because FMCG is also one of the top third sector in the industry. So before we move on, let me give you a brief thing about the Indian economy. FMCG sector is the fourth largest sector, and basically the three main segments like healthcare sector constitutes 31% of the Indian economy. Household and personal care sector is much more than, which is around 50%, and FMCG constitutes around 19 to 20% of the Indian economy. So let's again take a glance, and then we will talk about what is exactly happening. So if you remember what happened in COVID, that many things which were the essentials took a backseat, and if we see that there was a right shift which happened, which we were considering that it is essential. Now in COVID, it was not essential. Hygiene product, whereas industries like apparel have shifted to discretionary. So hygiene products like shoes, product like jewels, product like watches, apparels, basically all they shifted to backseat. Products related to hygiene came on front. Earlier, they were not on many of the forefronts. So fashion took a backseat, beauty took a backseat. In beauty, hygiene product took a front seat. Travel, consumer food services. Food services means all the kind of cafes, restaurants, all these closed up, travel closed, luxury, apparel, footwear, consumer electronics, alcohol, tobacco were severely impacted. These were some of the FMCG groups which were severely impacted. So again, as I discussed in the healthcare sector, certain of the manufacturers converted their facilities into producing mask, hand sanitizers, and ventilator. If I took example of Nestle, if I took the example of IFCO, one of the largest group in Middle East, Southeast Asia, and Africa, they were making just soaps. So apart from all the FMCG products in their personal care division, they were only making soaps. When the pandemic hit, instead of making soap, they started making sanitizers. They started making liquid soaps. So the demand of liquid soaps soared up, and the demand for soap bricks went down. So these are the small things, and their companies took an eye on the details, and they started manufacturing, and then they boom the market. So many of us do online shopping as well. So how our habit basically changed when we started this. So Corona, the consumer developed the online grocery shopping habit. And in fact, I was buying from grocers. In fact, I was introduced to the grocers during that time. And after that, it became a hit. And I'm still in the habit of buying grocery online as well. Okay. So this graph is, I just pulled this graph out of one of the reports I was studying in. If you can see this graph is from 2020. In January, this is the price of noodles, the Maggi noodles. So in January, February, and March. So you can see January to February, and in the first week of March, it's around constant kind of thing. Slow growth is there. But from March 15 to March 29th, you can see only in 10 days how it has went up high and then it came down again. So that kind of it happened because of supply demand issue, not at the manufacturing end, but it happened because of supply demand issue. In fact, many shopkeepers, many small time retailers hoarded this product, and they increased the prices, and it happened. So as I said in the second point, the package and fresh food, the stockouts and the price fatality makes the staples a luxury. Yes, that was true. You can so you can see a short example in the graph. What happened actually at that time, the staple foods, the macaroni, the pasta, Maggi noodles, all these prices went sold up because everybody went into panic, and they started making stockouts of the products, so they do not face shortage of them, because rice, pulses, and atta, in fact, were huge shorts at that time. So there was shortage of atta, wheat. There was shortage of rice, pulses. So people started taking stock out of these staple foods. So as I said in the previous slide, beauty and personal care. So there was a focus on personal hygiene, and I gave you example how many companies, Nestle, Mondelez, in fact Tata Group as well, They started making personal hygiene products and stopped the beauty ones. Many industries started focusing on consumer health, and there were multiple preventive healthcare remedies which started came. So just to give an example, if I take as a common citizen myself, what happened exactly that I myself remembered so many medicines. I knew that how to take steam, or what is the nebulizer, what is the how to take paracetamol, how the basic medicines I reminded of. I wrote in the copy, so I was trained well, and there were multiple advertisements, there were multiple videos which were shared about preventive healthcare remedies. So instead of admitting to the hospital, increasing the pressure to the doctors, there were a lot of health remedies which came. Consumer electronics and appliances, the decline happened, but again, we were relied on Chinese imports, and China was still importing and is still importing. Okay. Alcoholic drinks and tobacco interruption of sales happened. So tobacco, I will not say alcohol. So there was a basic myth about alcohol at that time. So alcohol industry remained normal because alcohol was in rich supply to make the spirits. Now spirit was used to make sanitizer, and sanitizer at the time, doctors and common citizens were considering um sanitizers which were having around 70 to 80% alcohol in that, which was helping them kill the germs. Although it was ethyl one, but it helped them. So alcohol as a drink was not used, but alcohol as a kind of making a raw material, making a spirit, it was used. Tobacco, it was totally stopped. Cigarettes were stopped. Many people and many friends I found struggling to get cigarettes, and many were selling it in black. So there were a lot of police actions happened on many retailers and outlets holders that they were selling cigarettes in black. Footwear industries and apparel and fashion industries became discretionary, and a lot of beauty shops shut down. There are a lot of salons which shut down in the COVID. And again, as I said, the restaurants, the kitchen, the restaurant, the cafes, they were severely impacted, and consumers moved back to kitchens. So let us, if we join on looking at the major trends which is expected of the FMCG in 2022. So of course, there is a e-commerce boom which is to come, and its contribution to revive retail sectors, and it is sure, e-commerce boom has to come, and it is coming up. Multiple sites like Amazon, Flipkart, they are there. If you talk about UAE, the souk.com is there. Okay, which is competing with Amazon. Many small type e-commerce growers has come. If you, I'm not able to remind many of others because, but I use it up. For the kids, First Cry is there. For multiple other, in fact, for jewelry, Tata Click is there. So Tata Click is for the normal thing is also there. Then Mintra is there, of course. Yeah. So all these e-commerce will help the FMCG industry to again rise up, and let's see how it moves basically. So basically, if you see, e-commerce for FMCG will reach 400 billion. So this is the data again I took from some research, and 10 to 12% of the global market. So Nielsen has estimated this, that 10 to 12% of the global market will be done by e-commerce. And in fact, the Indian processed food is projected to expand by 470 billion dollars by 2025. This is the forecast. Okay, so it was 263 billion dollars in 2019 and 20, and it is expected to rise by 470 billion dollars by 2025. Okay? So let's see, and once it increases, it forecasts a multiple of job opportunities and career opportunities as well. So post pandemic and pre pandemic. So there are two customers which are, one is post pandemic and a customer which is pre pandemic. So if you talk about both of these customers, they both are totally different. In fact, as a common man, and if I think about my customer, if I go to the market, what I buy and what I used to buy in 2019 and 20 pre-pandemic, pre-COVID is different. So now companies and FMCG industry especially has to understand the new consumer in this post-pandemic world. And this FMCG industry growth forecast, which I predict, which I see, is going to be huge, and it has to be a contribution of 15 to 16% in the Indian markets as well. And the new objectives which has to be there is around realigning corporate objectives and strategies post COVID. So industries, either it's healthcare, either it's FMCG or any industry, it has to be consumer centric. So they cannot do left and right. They have to be consumer centric. They cannot avoid digitalization, and they have to opt in sustainability environment. So that is the major thing which industries have to focus basically on coming days. So when we were doing hirings for the healthcare industry, so hiring of the healthcare industry in terms of the recruitment, because I belong to a recruitment industry, the hiring of healthcare industry drastically went down. So there were a lot of we were doing hirings of lot of nurses and lot of doctors in Middle East and Southeast Asia, and around the project was to hire 200 doctors and around 350 nurses in the year 2020 and 21. But we only ended up hiring 60 doctors and 45 nurses. So that was the data. And so you can see the drastic decline from 200 to 65. So that is the drastic decline in healthcare hiring. If you talk about FMCG hiring, we were hiring of head for poultry farms. We were hiring for head of AI, artificial intelligence. We were hiring for director of financial planning and analysis. So multiple other positions as well, if I can give you many titles. But we were hiring for manager of supply chains for one of the fresh fruit leaders in UAE, United Arab Emirates. So there were disruptions happened, and we were ended up hiring only 5 6 positions. So recruitment industries also suffered. So we as a recruitment industry lost around 1.3 cr to 1.4 cr. So from 7 CR, we were targeting to 10 CR. And from 7 to CR, we only targeted 7.9. So around 8 CR. So only 1 CR increment we did. So we lost around 2 CR in the pandemic area. So that was the recruitment industry update in terms of healthcare and FMCG hiring as well. So both the things dropped. But now in 2022, both healthcare and FMCG has shown that these two industry will be the market leaders in the near future. Because as per the hiring goes, we are hiring again. The hiring is surging up. The project which we took in 2020, it has doubled down. And for Vietnam, for Myanmar, for African countries of Sierra Leone and multiple other war hit countries, we are hiring multiple doctors and nurses in both the categories. So I think this is the end of the presentation and end of the slides from my side. I am open to taking any feedback from anyone else.
Sir, one question came. The question is asked by Unrolled that what is our learning in this situation?
So the biggest learning, if you talk about on a personal front, is humanity. Understand the humanity, understand how you help each other. That because that is the only one thing which came in useful for everybody else. Now on a professional front, what I say, what you learn from this COVID is to increase your skill. Either you are sitting at home or either you are working. So many people in this COVID times, they use the vacant time to train themselves. Many people got Six Sigma certified. Many people did some Google Analytics. Many people took certifications from Google's and other things. Many people got LinkedIn certified in recruitments. So that is the things which we can learn from this.
Thank you, sir, for answering the question. So, one more question arises. I am asking you in his behalf. In the future, how can we able to combat this that it will not happen the same impact? Who shall spearhead to avoid this occurrence?
Basically, we can avoid these things. What exactly happened today? There are a lot of safeguards which has already been taken. Healthcare industry has been upscaled. There were a lot of, so we have taken this learning from the past that a lot of hospitals and medical centers have set up their own oxygen plants. So when we saw the sudden deaths and sudden struggle of oxygen centers, a lot of oxygen, but this is not enough actually, and nothing is enough. We have to be a disaster management confrontive thing. So if anything's come, so any disaster can happen anytime. It's just we have to be disaster management centric. because next time the COVID will not happen. Next time any other thing will come which we will not be aware of. So all our preparedness will go in vain. So the thinking of disaster management will come into action. So we can say blah 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 about saying we can have certain oxygen centers, we have had multiple doctors, we are having health centers, hospitals, education, schools, but everything will not help you until unless you are psychologically prepared to handle any kind of disaster. Hope it answers my question.
Yeah, sir. Thank you so much for making our doubts clear. This webinar was really amazing. I would like to propose heartiest vote of thanks to you, sir, for gracing today's webinar. Your presence and wise word helps to magnify our cause in best possible way. I hope all the participants have learned a lot with this webinar. I would really like to thank you, sir, for giving your valuable time. I am delighted to be the part of today's webinar. A good event never ends in the world. They just take a pause and keep us awaiting for the next. All good things eventually ends. I would consider everyone as fortunate that they become the part of this webinar, which was full of knowledge, which makes us difficult to say goodbye. And remember, don't forget to subscribe our YouTube channel